Well, welcome back. You may not know, but 3.4 million people live with epilepsy in the U.S., and UC Health is the only region's level 4 epilepsy center. And Dr. Ficker is here from UC Health with patient Scott Badzik. Thank you all both for coming in. So this month is Epilepsy Awareness Month, and so I'm sure people have heard the term epilepsy, but may not really know exactly what comes with that. So when you're dealing with that, what is your body going through?
So epilepsy is a disorder of the brain characterized by recurrent seizures. And the seizures occur because there's abnormal electrical activity that occur either in part or different parts of the brain. And people can have a number of different symptoms from that, including loss of awareness, confusion, sometimes funny feelings. Many people think of epilepsy as resulting in seizures that are grand mal seizures or generalized tonic-clonic seizures where there's a fall to the floor and shaking all over and loss of consciousness. But there's many, many different types of seizures. Yeah,
and different levels. So you all are a level 4 facility, which is one of the few ones in the region. And so tell me about that.
So a level 4 epilepsy center is a multidisciplinary center with many different types of providers, both physicians that specialize in epilepsy, neuropsychologists, neurosurgeons that specialize in surgical treatment of epilepsy. And that's really the characteristic of a level 4 center, is that they offer surgical treatments for people with epilepsy whose seizures are not under good control with current therapies.
Yeah. And so Scott, you're currently living with epilepsy.
I am, since 2005.
Yeah, tell us about that diagnosis. How did you figure out that this is what was going on? What were you experiencing?
Well, mine resulted initially in a tonic-clonic seizure where I did, like Dr. Ficker said, a TV seizure where I was convulsing, was rushed to the hospital, and was eventually diagnosed. In a situation like myself, it was very dramatic for my family because I was an airline pilot, and that ended my career. Someone with epilepsy cannot fly airplanes, obviously. So, but over the past 19 years, I've been very active in the epilepsy community, and one of the things we're proud about doing at Cincinnati, at UC, is a patient advocacy program in their EMUs. So people like me, who I've had it for 19 years now, we can go into the EMU, meet with other people living with epilepsy, and sort of counsel and advise them on strategies on how to live on a day-by-day basis with this condition.
Yeah, I mean, and a career-ending condition for you. I'm sorry to hear that happened, but tell us, I mean, how does that happen? I mean, usually, I mean, is it genetic? Are you born with it? Is it trauma to the brain?
It can be all of those,
yeah.
But the vast majority of time, about 2/3 of patients with epilepsy, we can't identify the cause of their seizures. Okay. Only about 1/3 have an underlying cause, and that could be from prior head injury, prior brain infection. There are some genetic conditions involved as well.
Mm-hmm. And Scott, for you, treatment-wise, what has been the best for you?
I've tried a number of medications. I've had a surgery. Something called a vagus nerve stimulator has been implanted in my chest to help. It's sort of like a pacemaker for the brain, if you will. Different types of therapy, exercise, to try to control that. But I found that community reaching out to other people living with epilepsy has really helped me and others in our area through this program.
Well, excuse me, I'm glad that you are, getting some of the treatment that is needed. And so for those who are watching, who want more information, maybe going through something similar, what can they do?
Yeah, just to realize, particularly for patients whose seizures are not under control, there are excellent treatments available for them. Epilepsy centers do offer a number of treatment opportunities. In Cincinnati, University of Cincinnati has, Gardner Neuroscience Institute has the level 4 epilepsy center, as we talked about. There are level 4 centers across the country. And so, ask for your physician for a referral if your seizures are not under good control. There are also great organizations specifically for patients and families. The Epilepsy Alliance of Ohio, based here in Cincinnati, and the Epilepsy Foundation are also outstanding organizations that can help people that are struggling with the day-to-day activities with their seizures.
Yeah, all great information. Thank you all both for coming in and sharing that for those people. I'm sure it's going to be helpful to a lot of people. Thank you for your time. We'll send it back over to you.